Good afternoon, New Mexico. It's Governor Michelle Lujan Grisham, and thank you again for tuning in to these updates. We think they're vitally important to make sure that we're all working as hard as we can together to protect New Mexico and each other, and quite frankly, as we go through our presentations again, to really be clear about what we're doing to make sure that our healthcare professionals and our first responders are as protected as they can be as they do their job to treat and serve individuals with COVID-19 who will need hospital and related healthcare services. So we're going to do it in the same format we did it last week, which is, or earlier in the week, I apologize. We're going to talk about where we are. I'll give a case and hospital update. And Kathy Kunkel, who is the Cabinet Secretary for the Department of Health, will talk about testing. I want to talk about a little bit about what we've accomplished so that you can see that we're working on executing our ideas that help us plan for this pandemic in the most effective way, and to give you a sense, I hope, of security that we are using data and evidence-based strategies and getting support by the federal government and our private sector partners to make sure that we do that. I want to talk about where we're going, and that will be handled primarily by Dr. David Scrace, who's the Secretary for Human Services. He is leading an incredible public-private team that is working on modeling, which shows us, right, what to plan for, what to expect, and what we can do to minimize our risks related to this COVID-19 pandemic. And then I want to talk about what you should expect next. We'll go over some frequently asked questions, and we'll take questions from you and from reporters. So let me go to the first slide. I want you to be able to see what the bar looks like. We're at 495 cases today. We've added 92 new cases. Now, while that's striking to see the increase that we report every day, we are doing more testing. Now, what we know about this insidious virus is that it is among us. It is present in the state of New Mexico. We do have community spread, so we have to work even more diligently to continue, right, to stop that spread, to mitigate that, and to prevent the kinds of surges that we're planning for in our healthcare system. I want to also report that today we have 3 new deaths, bringing our total number of deaths to 10. And this is the most painful part of this job. Is to report those to everyone in New Mexico, and certainly that effort is nothing compared to the absolute loss for the families who have suffered this terrible, insidious virus. Our hearts go out to you and our prayers. We know this is an incredibly tough time, and to every New Mexican, please know that we are doing everything in our power to prevent as many deaths as possible. But as you will hear in our modeling, given our healthcare and aging, our healthcare issues and our aging population, this is a state just in that context that is a high-risk state, which means, again, we all have to do more to protect families and to protect New Mexicans. Today, I want to go to the next slide. This is our hospitalization and ventilator use slide. And so the blue line indicates the number of people who are currently in New Mexico hospitals. So we've got 41 to date. We have 18 individuals on ventilators. Now, why is this an important thing for us to be tracking? Well, we want to see that how many folks who get tested positive with COVID-19, to track how many folks need hospital care, and then to look at who needs critical care as we plan to make sure that we have enough hospital services, personnel, and equipment to meet the needs of every single patient. This chart in particular, these 2 lines, represents that we've got about a 44% number of patients in hospital care today who are needing the use of a ventilator. And we're going to talk more about ventilator use and acquiring the right equipment so that New Mexico and our hospital systems have everything that they need to manage this pandemic. But we want you to see how we track that every single day. That information gets out to all of our hospital partners. I do want to point out that our recovery number is at 34 and that we've got about approximately 17 people have been discharged from hospitals and are continuing their recovery journey at home. With that, I'd like now to go to Secretary Kunkel to update us on testing.
Good afternoon. I'm Kathy Kunkel, and we have, as you know, 60 sites that are established to conduct testing all around the state. Today, there are 44 test sites open in 22 counties. These are available, the times and the dates that they are open are available on our website, cv.nmhealth.org. However, if you don't have access to the website, you can call the hotline and ask where a site is available in your location. In addition to the 44 sites that are open today, the Department of Health meets every morning to determine if there are hot spots or places that need to have a test site set up on that day. And for example, we were able to go to nursing homes and to some of our pueblos as a result of that type of early morning work with epidemiology. Because we expanded our criteria for testing, we have seen a significant increase in the number of tests or collection kits we were able to perform. We've been at 5 nursing homes in the last 48 hours. We've been to the detention center, and we're working with other agencies to go to other congregate settings. And while this has resulted in a significant increase in tests that we are running at our 2 labs, I do want to remind everyone that there is still criteria, and that is if you have been a close contact or if you are a household member of someone who is positive for COVID, that is the person we really want to see at all of our test sites. With our increased testing, we are seeing a lot more work in our laboratories. SLD received 800 specimens yesterday, and TriCore is over 1,000. We continue to work with our labs, with both of these labs, to increase their capacity, as well as with the national labs, with Lannel, Sandia, NMSU. We thank you for now exploring your ability to test, and Gerald Champion Hospital has also begun work to begin testing. So these are all good things, and we continue to encourage people who need to be tested to come out to any of the sites or to call us. Thank you.
Thank you, Secretary. All right, so I want to talk about what we've accomplished, because I know that many of you are following what the United States response and state-to-state responses are to the pandemic. And I know that you're well aware of the challenges about having access to resources, about doing the right planning, about making sure that you're getting equipment from the national stockpile. I know that most folks, because I want to thank you for responding, going online, talking to us about your suggestions and ideas, your concerns. It is true that the state-by-state effort to go after supplies and equipment to treat COVID-19 patients is incredibly competitive. Frankly, it is a system that is not working for anyone, anywhere. And the bulk of our time, in addition to looking at the data, reminding people about mitigation strategies, doing what I'm now calling community containment strategies. So that's why we're focusing in areas where we've seen spread in nursing homes, some tribal communities or surrounding counties. We want to make sure that we deal with those as effectively as possible and to support those communities in the most meaningful way possible. But I want to give you some updates about work that we've finished up and have gotten the right approvals from the federal government, which will expedite our ability to serve New Mexicans. So one, we have the ability now to call up to 750 soldiers and air guards, men and women, in the state of New Mexico. You want to do that with the full support of the federal government. government. That's called Title 32 requests, which allow us, with an emergency declaration by us and the federal government, that the president must sign. It allows us not only to call up these incredible men and women who serve our state and their country, but it means that the federal government reimburses the state. And given the fact that we are in really tough financial times as a state, it mirrors the incredible personal sacrifices that happen every single day because people have limited their ability to work and in telecommuting, and many people, in fact, have lost their jobs. That is an incredible, negative, difficult dynamic. So where we can leverage federal resources, we should. What does that really mean? Well, it means that we have more folks who can help us do the emergency work that we need during this pandemic. That means that they're delivering meals. That means that they are gathering the supplies or the test samples from any number of these testing sites and bringing them as safe couriers to the labs who can run them. Not every lab, not every hospital can run hundreds of these samples at once. It's really important. We want to know in a 24-hour turnaround time, and to the degree that we can, even in 4 hours, we want to know what the results are of all of the testing that we're doing statewide. So that's critical. In addition, they're going to work specifically with President Nez and the council delegates at the Navajo Nation to make sure that we're standing up sort of service delivery sites in both Shiprock and Crown Point, really aimed at serving Navajo Nation members. And why would we do that? Well, given the rural nature of many of these chapters, they can't mitigate their social distancing because there aren't grocery stores. There's not even a place to make sure that you've got a safe, clean water available to you all of the time. That means that you're traveling more often. So if we can bring services and personal supplies right to areas that are more centrally located, then it means that we're serving this population and we're mitigating spread and we're really holding true to this social distancing. I want to announce that we talked about our regional work with the Army Corps of Engineers. Now, their job is to look for locations where we can have what we're calling step-down hospital services. And when you see the modeling, you're going to see that we're going to need that our current hospitals are going to need to be able to focus on more critical care for COVID-19 as we continue to prepare for a surge. So we have absolutely now reviewed, but we have selected now with the Army Corps of Engineers the old Loveless Gibson Hospital site. Now that's an area that's near the Veterans Hospital, and you should expect that we're working to get veterans approval so that not just veterans can be served in that hospital, but other patients, so that we're clear that we're leveraging every hospital resource. In addition, we've selected a high school in Gallup to also be available for step-down hospital care. So why is the Army Corps of Engineers involved? Well, they have to do the construction and engineering work so that these are safe, productive, professional spaces for hospital care, but don't require critical or ICU level of care. And they're going to be incredibly valuable in meeting the needs of New Mexicans statewide as we respond appropriately to this pandemic. I also want to talk a little bit about our efforts to get additional healthcare professionals. So I've been leaning in about no wrong door, no wrong turn. Every effort will be utilized to bring more healthcare professionals. We have finally gotten almost all of the necessary federal approvals, so much so we are now actively recruiting nurses in Canada, and I hope to see that opportunity right here in the state in the next week or so. We're going to have to quarantine this healthcare professional group, so the sooner that we get them here, we want to do that. Really, it's more of a self-isolation, but we're going to do the same strategy we do for every every New Mexico traveler. That's 14 days before you're actually in our healthcare system. But it shows that we're planning for what's coming. I also talked a little bit about the incredible companies and partnerships we have in New Mexico, and we're going to talk a little bit more during this update with you about personal protective equipment. But I want to talk and do a shout out to any number of New Mexico companies who are helping us do exactly this. So we've got a company called Marpac. They're helping make N95s. Now these are the respirator masks that healthcare professionals need, and I want to show you one of those later in the update. What's critical is any number of companies are working and leaning in to make any number of pieces of this personal protective equipment for healthcare providers and first responders. But unless we get the right federal approval, it can't be utilized to support our healthcare professionals in a meaningful way. So this is critical that we're getting these approvals, and I want to thank them for their incredible work to get that done. I want to thank 5 Ton Monkey Fabrication. They're making plastic face shields here. I want to thank Rhino Gloves, which is in Church Rock in McKinley County, for making our sterilized gloves, which are critical for our healthcare providers. And I want to thank Sandia and the Air Force Research Laboratory, because they've now got the federal approval necessary to begin looking at things that we're calling splitters and other ventilator equipment that allows us to leverage professionally and safely equipment to meet the needs of every single New Mexico patient. It means, again, that we're putting together a plan that's going to really do incredible work to do everything we can for a scenario that we think is likely to play out, although we can do better, and we're going to talk about that in a minute, to make sure that we're saving lives in the state of New Mexico. So I wanted to give you a sense that things are in fact occurring, that our relationship with the federal government, while that can be tense, that we're working on every approval necessary that protects New Mexicans to the highest degree from this day until we're able to together to move through this pandemic. Now with that, I'd like to turn it over to Dr. David Scrace, the Secretary of the Human Services Department, to talk about where we're going and give you a sense about the data that we have and what it looks like for New Mexico.
Thank you very much, Governor. And we'll bring up the first slide. I'm going to show you some information and data that we look at every morning here at state government. And the first slide is a map of New Mexico with what we would simply call an infection rate by county of COVID cases. And it's the number of cases per 100,000, which is not a familiar term to most of us, but it's what epidemiologists use to track. And I'm going to ask you today, as we go through these slides, to pay particular attention to the darker upper left-hand corner of the state, the Northwest, where we're seeing a significant increase in cases, particularly San Juan and McKinley County, which started having cases just a week ago and have really rapidly had it. And I'll say more about that as I go. But basically, we are monitoring in every area, and Secretary Kunkel explained how our epidemiologists are going out and spot testing in areas where there may be an outbreak. But remember that northwest corner of the state. This is a busy slide, and I'm only going to hit a couple points. There are reasons why New Mexico is at higher risk for a higher rate of death, mortality from COVID, and there are really 4. Number one, we have a rapidly aging population. We used to be 39th in states in 2020. We'll be number 4 in 2030. Our population is aging. And I'll show you a map of that. We're number 1 in America for chronic liver disease and cirrhosis, which increases risk of death with COVID. We're number 7 in America for diabetes, which increases risk of death with COVID. And in particular, there are some Native American tribes that have a very, very high rate of diabetes as well. We also have more accidental death and suicide in the top 10, and that can be related to substance use disorder and depression or other behavioral health issues. So we're paying particular attention to that. And I hope the people of New Mexico will pay particular attention to this as well. If you have one of these conditions, then you're at higher risk. This is the age breakdown of the state, people 60 years and older. And while on average we're 22.7 and above the rest of the country, maybe we can put that slide up right now. You can see that some counties, including Harding, is even over 50% of people there are over 60. So again, if you're over 60 years old, you're at higher risk for COVID infection and complications from it, and stay at home if at all possible. Diabetes, same thing. And again, notice the northern part of the state, the higher, that's the next slide, the higher risk of diabetes. And this is the percent of people in each of our state counties that have diabetes. And so, again, we're 11.6% statewide, but actually higher than the whole United States. And as I mentioned earlier, one of the top states. So again, higher risk for us, more reason if you have diabetes to stay at home. This is a real complicated slide. The next one, it's COVID-19 cases by U.S. states and territories, and this is a focus on New Mexico. There's lots of blurry lines that no one watching this will be able to see, but in this particular situation, down is good. The lower the line, the better. And you can see New Mexico is among the bottom 2 or 3 states. And what this is a slide of is the growth rate of COVID infections in a state, and the lower the line, the better we're doing. And so we're real pleased here in New Mexico that our growth rate has been slower than the rest of the country. We believe that the social distancing that has been put into place and the cooperation of New Mexicans to participate in that has been the main reason why we're seeing this lower trend, but it's really important, and I'll say more about it later, why that is. The graph really on the left axis there shows the number of cases. On the right axis, the number of days since 20 cases. And New Mexico is doing well. Another term that we talked about the other day is, on the next slide, is doubling time. How long does it take for the number of cases to double? And you can see that at the very beginning, early on, we were very similar to New York at a doubling rate of 2, which was New York's rate. But through social distancing and through cooperation of the people in New Mexico, yesterday we were at 3.78. Today we're at 3.94, which means basically that we're in other countries and places where the number of COVID cases has doubled every 2 days. Here in New Mexico, it's doubling every 4. And that's way more than 2 times better. It's thousands of times better. Because if you have 2 people, they infect 2 more people, infect 2 more people. That happens every 2 days. In New Mexico, we've slowed it down. And that'll be important when we start talking about the delivery system. Last time I gave some numbers to you all about what we were thinking about in terms of how many hospital beds, ICU beds, ventilators, and deaths we were anticipating. On the next slide, a busy chart, but let me walk through it with you. The one before that, I believe. Yeah, that one. And so let me just walk this through. We've got, on the left-hand column, the level of social distancing that's been put in place. And I would say right now New Mexico is somewhere between moderate high and high. And I think if every New Mexican was doing everything that was asked, we'd be much closer to the high intervention. And I'll ask everybody to do that again today. But the delivery system, our hospitals and nursing homes and others in the state are really planning for this middle scenario, the moderate scenario. And you can see here that if you look across the columns, this involves all the things we've done: school closures, social distancing, limited gatherings, most non-essential businesses closed. We anticipate at the peak of COVID, when the most people are infected, that we'll have 3,498 people in the hospital. 2,175 people in addition will be in ICU beds. So the 3,498 is general hospital beds, 2,175 ICU beds. We think we'll need 1,629 ventilators, and we would anticipate with this moderate level of intervention about 3,000 deaths in the first 12 months. Note that the deaths in the high intervention are lower, and that's really important because when we stay home, when we cover our mouth with the Kleenex when we cough, when we wash our hands, when we keep things clean, surfaces clean, we're actually moving to that higher level. I want you to remember those 4 numbers that are in the red box, because I'm going to come back to them in just one slide, in 2 slides. The next slide just shows the kind of track we're keeping every single day of our capacity in New Mexico. And we have a medical advisory team working for the Department of Health, lead physicians from the major health systems in New Mexico. We're working all day, every day to build this out and understand more fully what our capacity is. On the left, you'll see another map in New Mexico that tells you how many ICU beds were open this morning in the state. And on the right, you'll see a graph that shows what % of our total beds are full this morning. That blue arrow off to the right, shows what the capacity is. So as of this morning, about 72% of our hospital beds were full, which means 28% are open. And we have this kind of tracking information for everything that we think can be a critical resource. Going forward, I'm just showing you one today that is relevant. So this is probably the most important slide I'll show today. And I want to explain to you how hospitals are thinking about what they're going to do when the surge of COVID patients comes to their door. And so there are three basic levels of resource that hospitals can provide. There's the baseline level, and that's of the hospitals in New Mexico, and you'll see that on the side in the left column, of the, in our existing system, how many hospital beds are available. It's not the total number, it's the number of beds that we've projected this week, and when the surge comes, that will be open, because of course, having a COVID pandemic does not keep other people out of the hospital. People are still getting care, so we can't open up all our beds. That 776 will be available. Our ICU beds will be 126, and we have 265 ventilators in operation that will be available that day. The next term on the next line down is surge capacity, and that's when hospitals expand to every single possible resource they have within their license with the Department of Health. So they're looking to other ways of adding patients to rooms and other things like that. And you can see that we think during that surge, we're going to need over 1,000 general hospital beds, including 65 ICU beds, in addition to 483 ventilators. And then at maximal capacity, we expand beyond what's licensed, and that's when we get to the crisis standards of care, where we're now doing everything we can to serve people and keep them alive. And Secretary Kunkel will declare when that day comes that we've entered into the crisis standards of care. And we will see patients in the hallways in hospitals. We may see 2 people per room in an ICU, and we may even see 2 people on ventilators. We hope that doesn't happen. And you can see those numbers there as well in terms of what we're going to need. 2,200 general beds, 589 ICU beds, 625 ventilators. And the need that I showed you in the previous slide, 2 slides ago, those are the same numbers: 3,498 general beds, 2,175 ICU beds, and 1,600 and some ventilators. And if you notice in the red box, you've probably already done the math and notice that, wait a minute, we're going to need more general beds than we have right now. We're going to need 1,281 more. We're going to need 1,586 ICU beds and 1,004 ventilators, more than what we currently have in our possession. So what are we doing about that? We have a medical advisory team that I've mentioned. I mentioned last time it was led by Michael Richards, Troy Greer, who's the CEO of the Loveless Hospital, and Troy Hildeman, the COO and Chief Operating Officer of Presbyterian, are working all day, every day with hospitals all across the state to build out a plan of how we're going to do this. And they're coming up with some really great ideas. Already, they're already decided to build out another couple hundred beds at the old Gibson facilities. The governor mentioned 50 more beds in Gallup will be going up in the next couple weeks. Just yesterday, the hospitals in Farmington, that northwest corner of the state, called out and said they needed more intensive care help. And so today, Presbyterian IT people are driving up telemedicine equipment to put in the ICU so that doctors, critical care specialists in Albuquerque can provide continuous coaching, advice, consultation for these docs in a rural area to try to spread our resources across the state the best we possibly can. I have a great deal of confidence in the people who are doing this planning. They're the smartest people and the most experienced people in the state at either running hospitals or disaster management. We've got a great team, and unlike most disasters, we still have a couple, 3 weeks more of warning, which gets me to the next slide, which is our modeling and what we're seeing. So we believe that we will see that hospital surge that we've been talking about. It's not the peak, but the surge when we come up against the maximum number of hospital resources sometime between mid-April, the third week in April, and then somewhere maybe into the first week in May. And as soon as I say when the surge is going to happen, I'm wrong, because the surge is really going to happen at different times in different places, depending on the characteristics of spread of COVID in communities. So we've already mentioned we're seeing a rapid rise in the northwest part of the state. I think their surge will happen in Gallup over the weekend. I mean, we've already sent out 10 more ventilators to Gallup, so it's happening right now. In Farmington, very soon, and then some will be later. We have a dozen counties or so still with no COVID cases, or only a small number, and so we would expect that they would be 2-3 weeks after that. I mentioned that the MAT, Medical Advisory Team, is planning those crisis interventions. We update that model every week on Mondays, and so those numbers will be revised, and we'll stick with them for the whole week. And then lastly, just to mention one more time, that if we can slow the spread of COVID, it's going to push out the surge even further, and it's going to reduce the height of that peak. I had one other thing I wanted to mention here that's important, and that is that University of New Mexico informs us that the number of people who are seeking substance abuse-related treatment has dropped significantly during the COVID crisis. And just want to make it clear that that treatment is still available. It can be done over the phone. You don't have to go into a facility. The New Mexico Crisis and Access Line, which is 855-NM-CRISIS, C-R-I-S-I-S, can be called. We would encourage you to take advantage of those resources if you need them. The last slide just is my pitch to the people in New Mexico. We thank you so much for everything we've already done with social distancing, and it's that table with the green box around it, with the highest level of intervention. And what we're asking, I told you that we're planning for the moderate level and those numbers there, but we still believe that through actions already taken and additional actions that every New Mexican can take, we can get down to the numbers in the top row, and we can do that. We can expand our capacity to cover those number of folks and take care of them. So please remember that of all the things that every team is doing to combat COVID in this state, what the people of New Mexico are doing to stay at home, wash your hands, avoid as much contact as you can with other people, those are the critical interventions. And we really do want to move from that moderate scenario to the high scenario to enable our delivery system, and actually every single New Mexican to have access to the resources they need to get the right level of care in the right place and the right time. Thank you.
Thank you very much, Dr. Scrace. And I know that these are long updates, but I hope they're an indication that if we don't do this work 7 days a week, 24 hours a day, with shifts of incredibly talented, dedicated New Mexicans who are very clear that the more information that we provide you, the better effort we can all make at this together. And the only real way to attack this virus is to stay away from it. And you stay away from it by doing as much social distancing and social isolation. So, you know, when you looked at that red line, and I'm looking at it again right now, and I don't know that it can go back up, and it doesn't have to, and we'll put all of this on our website. But when I look at the fact that I need 1,281 more beds, general hospital beds, and 1,586 in addition ICU beds, and an additional 1,004 ventilators. And if you're watching that states, even with an epicenter, are getting 100 ventilators or 10 ventilators at once, some states are complaining that as those ventilators are provided by the federal government, they're not operable. It is incredibly challenging to get this equipment. Now, we're going to fight. I do that every day, and we're going to keep doing that, and we're seeing some success to that fighting. But the only guarantee is if you can help us stop the spread. We get to that high intervention level, then that's fewer general beds, fewer ICU beds, it is fewer deaths, and as important to that is that it will quite literally save the lives of first responders and healthcare workers who are completely dedicated to do everything they can to protect you. And I know that you're seeing it all over the country, where people are going to work into hospitals without the right protective equipment. And they do it making whatever they can work, because they're not going to not go to work and make sure that you're getting necessary healthcare services to save your life. But we can do a much better job by just preventing that. And I wanted to do a couple of things. I want to let you know that we get a ton of questions about ventilators. There are lots of conversations going around the country. How do they work in an ICU? What are they talking about when they talk about CPAPs and BiPAPs? And what are they talking about if they have to split? What does that look like? How is that going to work? And I think knowledge is power. Gives us a sense about what we're all doing collectively to protect you, that you're doing your social contract to protect us by doing social distancing and mitigating contact with other human beings. But I think it's also useful to see it. So doctors who have all come together have put together a video that we're going to make available later today, and it will be on our websites. It will give you a sense about what it is specifically that we're talking about and why it's so critical that A, we get access to all of this necessary life-saving equipment, but B, that you do your part to make sure that not as many New Mexicans will need this life-saving equipment. And we're also going to do more to talk about personal protective equipment or gear, but I want to kind of give you a sense. I mean, in a lot of ways, this is a hospital, this is the gown that you would wear over your clothing to protect the patient from whatever you might have on your scrubs or your clothing. This can be discarded after you've come into contact with patients, and it seems simple enough. Well, where these were just a few cents, they're now $5 and $6 a piece, and they're incredibly difficult to come by. They're also incredibly difficult to make in a sterile environment. So I want people to see it so that you have a sense about what we're talking about, and know unequivocally that it takes hours, planes, trucks, bargaining, negotiating, and incredible effort to even secure these items. Here are a pair of sterile gloves. These must be used by healthcare workers, first responders, everyone doing the test sites. They have to be safely removed and discarded. We've had trouble locating these gloves. These are probably the most used item in PPE, probably these and the gowns. They need to be discarded. We're working on some reuse strategies for other items where we can do re-sterilization safely. And in fact, New Mexico is leading because we have access to incredible experts, including at our national labs and research laboratories, who are helping us re-sterilize any number of pieces of personal protective equipment. And I want to thank one of our own companies, Rhino, which is making these gloves, these sterile gloves, and again, we're making sure that they're safe and that they can be used, and we do that by getting federal approval. So they're tested. You know where they're they're tested before they get federal approval? They're tested right in your research universities and at the national labs. It's an incredible partnership, making sure that we're focused on protecting our healthcare workers and our patients. Now, this is a surgical mask. I know that you see these all the time. I know that you see these in other countries where individuals are wearing these. You know, they simply go over, on. Well, I'm going to talk to you about these. These are also incredibly hard to come by. These are called procedure or surgical masks. They're intended for a healthcare provider to make sure that they don't sneeze or cough, or when they're talking have any of those aerosolized particles that are just natural in human-to-human contact. We don't want them spreading. These are not all that we need to protect our COVID-19 patients and to make sure that healthcare workers and those patients are adequately protected. So what are those? These are what we're calling respirators. I'm sure that you've seen lots of information about this. This is an N95 mask. These used to be about 80 cents. They are now on the market anywhere between $8 and $10 a piece. Finding these and getting these manufactured has been an international challenge. I fear that it's even getting more difficult to acquire these. And why did I want to show you these? Because we're looking to acquire them all the time. We are making sure that we look at this in the context of a 10-day supply starting, today, making sure that we can meet those needs for our first responders and healthcare workers for 10 days, and that we keep building that, and that we recognize during our surge and capacity issues that we're addressing that we're going to have even more available. Can I promise every healthcare worker and every New Mexican that we're going to have enough of these? I can't. The only way that I do that effectively is if we don't have to use as much. That means that I need fewer people in the hospital. That means that you have to do more. We're going to talk a little bit in a minute. I'm going to ask Secretary Kunkel to help me with that, to talk about what you might do about your own masks and maybe protective equipment or clothing that can help mitigate potentially the spread. So expect that video about ventilators. Expect more information about personal protective equipment. Please don't buy surgical masks and N95 masks. We want to create a vehicle where your state, your hospitals, and your providers can access these and make sure they're available for the folks that we need them for. What else should you expect? Our formal orders extending our instructions to stay home and the closure of business and the identification of essential businesses will be extended through April 30th. Now, you saw when we expect last week of April, first part of May, when we think these surges are going to occur. It only makes sense that in connection with making sure that we've maintained school closures, that we're very clear that we need you to keep doing this work, and we know that it's hard. You should also expect that we're going to change the way in which folks can go to big box stores, including Home Depots and Lowe's and Walmarts and Targets. We're still going there in crowds, and I know that people need the merchandise and the groceries and the personal items that are sold at these stores. But I need you to do better, because when you don't do better, it causes us to have an order requiring people to do it, and it makes it more difficult to access those items, and that's not what we're trying to do. But I want New Mexicans to know this: I will do anything that protects New Mexicans, protects New Mexico families, and that protects our healthcare workers and first responders. That means we have to have fewer people who get COVID-19. That means I need fewer people in the hospital. So anything that does that is on the table. People are asking us why we don't have an order restricting, Easter's coming up, congregate religious gatherings. Well, I want to thank the faith-based community who has worked voluntarily in New Mexico to cancel in large part, and we're going to keep working with them. Our goal is not to have any congregate religious activities over Easter, right? Home is holy. We know that individuals will practice their faith, and you should. And I think actually that makes a difference. We just don't want you to do that in a congregate setting. It is not safe, and it is not fair, particularly to those elderly parishioners who are at much higher risk for critical care in a hospital. And unfortunately, they are at much higher risk for not surviving this virus. So I need you to do more. And last, before we take some other questions, I just want to say, I want to thank you. I cannot tell you how many New Mexicans text or write or email or call and ask about my family. And I want you to know that I care about your family too. I haven't seen my mother, Sonia, who lives in a small assisted living in Albuquerque, in a month. I want to congratulate my brother, Gregory, who's gone by and visited outside through a window, waving and using large sort of flashcards to make sure that she knows that we think about her every day and we call every day. She can't quite use FaceTime. I wish that she could. But I get to hear her voice, and she's doing really well managing. And I want to thank the caregivers who, at great personal risk and sacrifice, make sure that my mother and every other single resident there is safe and cared for. And I would tell you, they show them incredible respect and love every day, and I'm incredibly grateful. For those of you who have asked about the first Manny, Manuel Cordova, he's been at home for more than 2 weeks. He doesn't go to work. He's had to reduce his workforce, but he's keeping as many people in his body shop on the payroll as he can, and it's hard. No one's allowed to come in. There's no reception area. If you need your car in that kind of a business, not a pitch or a plug to be repaired because you can't get to work or go to grocery stores, well, they will do that work, and so will any other body shop that's been listed as an essential service. But you have to leave it outside, and you have to put your keys in a sterile environment, and nobody touches anything in the car without not FDA and medically approved personal protective equipment, but they really work to mitigate spread. And I want to thank his company and his leadership for keeping as many employees as possible, but it's hard. It's really hard on all of these small businesses who, without the stimulus and waiting for it at the end of the month, is precarious at best. But his health is good and his spirits are good, and he takes his effort very seriously about protecting every single New Mexico family, including his. And so I thank you for asking me about my family and working hard to keep us safe, and we're doing the same for you, and we try very hard to lead by example. And haven't seen my children or my grandchildren in a month, but I thank them for their own social isolation, telecommuting to work, and the fact that they thank child care workers every day, but have not been using child care, but doing that from home. All right, let's go right to some of the frequently most asked questions. Everyone wants to know, should you wear a do-it-yourself cloth reusable mask? Will that prevent you from getting this virus? Can it prevent you from spreading the virus? I don't believe the answer is yes to either of those. I don't think it prevents you from getting it. I don't think it prevents you from spreading it. I do think it can make a difference by just slowing it up, protecting you a bit further. And we think that the federal government, the CDC, is likely to announce that those are mitigation strategies we should undertake. I want the Secretary of Health to talk a little bit about that, because we're going to do evidence-based messaging about how to use them, where to get them, and we want to make sure that New Mexico does this right. Secretary.
Thank you, Governor. Yeah, two things have changed recently in our discussions about wearing masks, and one is that we know now that the virus can be spread by asymptomatic people. So if they're wearing a mask, they can reduce the spread that way. We also know now that the virus does not have to be spread by droplets or sneezing, that it can be just in the air that someone breathes. So for those two reasons, I think that it is a prudent strategy to start wearing some type of covering when you leave the house. Again, we cannot use medical grade equipment, But we are hoping that the CDC comes out with guidance. We know that multiple layers of a cotton fabric that are up against your face are probably the best that we can do at this time. There are many sites on the internet that have some suggestions about how to design these. They're clever, they're homemade, there are groups that are sewing them in different organizations. When we vet them through the CDC guidelines, we will put that information on our website. Thank you.
I really appreciate that. So I want to just reiterate, we are not requiring New Mexicans to wear cotton do-it-yourself masks. We do not want any New Mexican who is not a first responder or a healthcare worker to buy any of the masks that I showed you, the N95 or the surgical mask. We want you to, if you're interested in supporting us to mitigate, non-medical masks. It's really important that we distinguish the difference between those two things. Otherwise, we'll exacerbate a fragile system even further. And if you can make these masks, as we get more guidance, you know what? You can go to newmexico.gov and tell us that you're willing to volunteer to do those, because there are going to be lots of families who won't be able to get those resources or materials together, and we want to make sure that we can provide them access. And that's another frequently asked question. What can I do to volunteer? We still need help with food preparation and food delivery and blood donating. So please go to newmexico.gov. We really need as much of that effort as we can. I appreciate you. People are still inquiring about where they might be able to donate. We really appreciate that. We've got a fund that's got commitments of well over $1 million. That's altogether newmexico.org, altogether.nm.org. Please and thank you. I mean, when we all work together, we can take this very terrible situation and we can do something meaningful about it. We can plan, we can prepare, we can refuse to be panicked, and we can be really clear that we have a social contract with each other to support every New Mexican so that we minimize the number of hospitalizations and deaths. And we had a slide one more time. Just want to make sure that people are clear about our websites. Now remember, if you've got a health question, you're a provider, you're an individual, you think you've got symptoms, please call this hotline, 855-600-3453. Go right to the website, cv.nmhealth.org. For anything else, unemployment benefits, food delivery, questions about work, questions about our orders, restricting access to businesses, identifying essential businesses. If you have an issue or a complaint, or you want to wish someone well, you want to donate blood, go to State Resource Information Hotline, 833-551-0518, 833-551-0518, newmexico.gov. I want to thank everyone for spending so much time with this incredible team. I want to really promote that this weekend I need you to stay home. It's really important. And am grateful for those of you who have done your part and more. And Nora, if we've got questions, we are ready to take those questions.
All right, so I'm going to unmute the press, and they will ask you questions, and you'll hear them on the speakers.
All right, we're working on getting this high-tech stuff perfected, so thank you for everyone's patience.
First up, we have Dan Boyd with the Albuquerque Journal. Dan, you are unmuted.
Dan, you are definitely not unmuted.
Maybe on his end.
Dan, have you asked your question? Okay, we're going to come back to Dan. We're going to go to Algernon from the Las Cruces Sun News. You are.
Hello, and thank you. Thank you. Right now, the southern part of the state has a comparatively low number of cases, but as we heard earlier, that can change. And I'm wondering if there are how would down the road plans work if suddenly we needed to move capacity into the southern part of the state in a hurry?
All right, I'm going to ask Dr. Scrace to tackle that, but I do want folks to know that is a critical question. Every hospital, every healthcare provider, public and private, are all working together so that we can move resources to that community. We can also safely move patients where they need specific resources in, say, Bernalillo County and Santa Fe County. So it's going to have to be a pretty fluid effort. And if we see a rise in cases or what we might determine as hotspots, we will also look at more specific regionalized community containment strategies. We're already doing that in the northwestern part of the state and some areas and some nursing homes or continuing care communities. So everyone in the state should expect that we have the ability to respond in that way should there be a need to. Dr. Scrace.
Yes, a part of the work that the MAT, the Medical Advisory Committee, is doing is setting up a statewide network of hospitals. In addition to the COVID-only alternative care sites, there are several hub hospitals in Albuquerque and spoke hospitals throughout the state. In Las Cruces Memorial Hospital is the hub hospital for the southern part of the state, and they're in daily conversation with the leaders of this effort. We also, in the coming weeks, will be doing more regional modeling. So what I talked about today was sort of the sum of everything that's happening in the state. But next week, we have folks, and Jason Mitchell, the CMO of Presbyterian, is leading this effort, who will come back with regional models so that we can even do better planning. Of course, based on what you saw today, their primary focus is on the northwest corner of the state, but you will see modeling roll out for every area of the state coming up in the next couple of weeks. And next week, I believe I'll have the information I need to create, to show you a picture of how this hub and spoke model will be working here in New Mexico. Thank you.
Next, we are going to go back to Dan with the Albuquerque Journal, see if we have you this time. Dan, do we have you?
Honestly, Dan.
Dan, I'm going to come back to you.
Have him text you when he's ready.
Okay, we're going to go to Celia Rainey with New Mexico In Depth. Celia, you are unmuted.
Many people are asking about a lockdown on social media, saying that's the only way people are going to actually stay at home. Is the governor considering strengthening the stay-at-home order or issuing a new lockdown order?
I'm going to go to the latter part of your question. There should be. There is a lot of attention now that each of the states are different. What we're doing isn't exactly what Arizona or Texas are doing, and we've got people delivering supplies. That creates more spread of this virus, and that the whole country should go to something called a lockdown. Not even sure there's a definition for that. And that creates, I think, real confusion. Look, everything that protects us and mitigates the spread of this virus really ought to be on the table. But you do need essential services. So if you were to do something that says, look, we're going to minimize ability to get food in a rural state, can I get food to everyone in the state? So you have to really think about those strategies. But to your point on the second part, which is, are you willing to do more to tighten it up? Absolutely. So we're extending the orders through April 30th. Two, we're going to do metering. What does that mean? It means that we've got a formula that we'll announce Monday that says, for example, in big box stores, that you can only have this many employees and you can only have this percentage in the store at any one time based on what your fire marshal indicated capacity is. Because what we've done so far quite hasn't taken hold. That we're seeing what certainly appears from the outside, where people are, and I get it, staying at home is hard. It is incredibly hard. But when I have 300 or 400 or 500 people who attempt, and I know there are lines outside, and I know that people think that they're 6 feet apart, but it's too much human contact, and it's too much socialization in a context that we did not intend. If I can't get organizations who we've exempted to do what we've identified as best practices by minimizing any of that contact to 5, if we have to make that smaller, if we do anything different, anything and everything is on the table. But given that chart that you saw about doubling time, I think that we gain more by having people show us what they're made of, by adhering to these policies to the highest degree that they can. And I want to thank everyone who's been doing more work online. So, and then maybe the last thing, and I probably went too long, and I know Dr. Scrace wants to say something, and we want him to. These experts are critical. But I do think we can do more in community containment. And I'll give you an example what I mean by that. If we've got folks who are traveling on I-40, let's say we've got a family who is not working and sort of deemed this as an interesting road trip, we don't want them stopping and treating New Mexico as a tourist destination. We know that we've got communities that are sort of gearing up for the spring and summer months. We want to be careful about that advertising. If we need to put up more road messaging that we are not open for tourism, that none of our tribal communities are open for tourism, if we need to block certain access points to some smaller communities with their support and permission, then we're looking at maybe developing those policies. Because if we can't make the doubling time longer, we can't slow the spread, then I absolutely have the courage to make whatever decisions keep New Mexico safe.
Yes, thank you, Governor. There's an old saying in business, you can't manage what you can't measure, and one of the things that the medical advisory team identified on the first day was that our biggest intervention that we have to reduce the spread of COVID is social distancing. And I showed a slide earlier in the week of one way of measuring social distancing. You may remember that the northern part of the state was doing pretty well and other parts weren't doing as well. We are contracting with a private sector firm. By next week, we will have county level information. We're working with mayors in the state of New Mexico if they would like to divide up their city into different segments, and we'll begin to have a lot more direct information about where is this working and where isn't it working, so that we can kind of diagnose that. Maybe it's giving feedback to a region of the state, maybe it's the governor calling a mayor, but we really want, and this will be on our website, we really want people to see how you're doing in your area, and it would be great if there was more peer pressure to stay at home. So we'll be providing that data next week. I think you'll find it informative, and you can work within your own neighborhoods and cities to sound that alarm if what you see you think could be better.
And while you want a statewide strategy that's meaningful, and we have that, where we can have local strategies that are more meaningful and also address any unintended consequences, for example, limiting access to the basic needs that each family has, or healthcare, we are cognizant of that all the time and want to make sure that we're dealing with that effectively. But we want the ability to show you and to utilize data that allow us to come up with very specific, localized efforts and solutions. That is how we win this battle to the highest extent, and we're prepared to do it. Next question.
Next, I'm going to call from TJ with KOAT. TJ, you are unmuted.
Yes, thank you. Governor, yesterday, the president said that some states are doing well with social distancing. Although New Mexico was not named, it was said that that states that have a lower than 5% positive rate are doing well. As of this morning, 2.7% of the tests in New Mexico came back positive, one of the lowest rates in the country. It appears we are doing well and may have one of the lower rates in the country. Do you feel we are doing well, and should we be doing a better job?
Both. Yes, I really do think that we're doing well, and I'll tell you why. We made decisions, and I thank New Mexicans because they participate in these decisions every day. We started early. We engaged the healthcare community early. We know every partner at the table, including elected officials and all of our sovereign nations, early, before states were even thinking about challenging or changing the way in which they were dealing, say, with their core industries like tourism and the way in which we were operating tribal casinos and gaming in the state. You know, we went after that segment, that's huge gatherings, early. I think unequivocally that the data bears out that that made a huge difference. Closing schools early, right? Limiting all those other activities. But this is a country that has not done enough testing, and while we're in the top states for testing, and again, I've pointed out that we're really proud of that aggressive work, we still have requirements to be tested. You still can't do the kind of surveillance work that you ought to do. We think that there's more prevalence, not just in this state, but in every state in the nation of this terrible virus. And so while I appreciate those measures, we want to do more. The second you let up, and if there's grading, and I don't want that for the country, the second you let up, it's an invitation to this virus to present itself it's insidious in any number of ways and continue the spread. And you can see that even today, it's terrible news. In a particular area where we've got a long-term care facility, it spreads fast. And it resulted in the deaths of 2 individuals. So I do appreciate that we've got data that says our measures are working, but we can still do better, unequivocally.
All right, Dan, I'm going to try and come back to you. Do I have Dan? Governor, Dan's question is about the retirement home situation in Albuquerque, if you want to address that a bit.
So I did a little bit, Dan, and thanks for asking the question. Look, these are areas that everyone should be concerned about. Why? Closed and close communities, the most fragile, vulnerable individuals, and I want to do a shout out. Caregivers in these facilities have undergone strict protocols and procedures. We also did that early in the state of New Mexico. I want to thank the Department of Health for being so incredibly aggressive. In fact, we're actually talking to other states that you should limit visitation. You should take temperatures of people coming in and out, the workers. Be really careful about your procedures when you have deliveries coming in, which they need to take care of the residents who are living there. In the case of the Albuquerque facility, where we had 2 deaths today, what's really tough is, based on the information that we have from the investigation that is ongoing, you have someone who had no symptoms, was doing their work, and we thank them, because if they don't go to work, these individuals are even higher risk of incredible illness, sickness, and potentially death without 24-hour care and assistance. No way of knowing. And the second that individual had symptoms, tested, an entire effort to safeguard this particular facility is underway, including widespread testing. That's what we will continue to do, and it's not the only place that we're doing that. We are involved very directly in at least 3 long-term care facilities, with every single licensed long-term care facility in the state required not to allow familial visitors, to make sure that they're checking workers coming in and out, that they're clearly engaged in using personal protective equipment and the best CDC guidelines for direct care and reporting information to us, and we're trying to do more surveillance in general. We think that's the best way to protect this population, but it is very troubling and a sad day for all of us to see that an area where our most vulnerable populations are at risk have in fact suffered from COVID-19. New Mexico should expect us to do as much as we can, and again, our hearts go out to those families, but that's the situation that we have in Albuquerque. We're spending some time at a independent living retirement community, not a long-term care facility in Sandoval County, and we're spending time in a facility in Santa Fe, but again, we're doing widespread work with long-term care facilities in the state.
Thank you, Governor. I'm going to unmute Michael Gerstein with the Santa Fe New Mexican now. Michael, you are unmuted. All right, appears we don't have
Michael and Dan are together.
Michael quite yet. Do I have Morgan with the AP? You're unmuted. Are you there? Don't have Morgan. All right. We're going to go to Julia Goldberg with the Santa Fe Reporter. Julia, do I have you? You're unmuted.
You do. Can you hear me?
Yes, thank you.
Great. Oh, should I just ask it?
Yep, go right ahead.
So I had two questions. The first was, I know we've been told in the past Bernalillo and Santa Fe counties have community spread, but I'm not clear on if all the counties with COVID-19 now have it or which ones do, if not. And secondly, I wanted to follow up to ask more about the data that will be released. Will we be learning which counties have how many, which hospitalization and recovery data by county, and then more granular data regarding gender and age for those hospitalizations and recoveries? Yeah, that's it. Thank you.
Let's do the last part first again. Maybe it's just the way that my brain works. So yes, we think it's really important to see data about who's been impacted by COVID-19, who's in the hospital, who's in our critical care areas. We want to look at that data by any number of things, right? Gender, demographics, age. It allows us to really think about messaging and support for communities to do even better work to protect New Mexicans. And quite frankly, this data will be incredibly important over a year's time as this country looks to figuring out, what do we know about this virus? What do we know about spread? What do we know about asymptomatic individuals? What do we know about gender and age and coexisting or chronic care conditions? What do we need to know about a vaccine? What can we do about treatment modalities? So all of this data is critical for our researchers here. It's critical for us to message for families, and you should expect more of that, including where people are in regions of the state. We think this information is valuable for folks. One thing that I want to give as a caveat to New Mexicans, this data isn't intended to give a grade per se, that if you're seeing more community spread in a particular region, that somehow that region is at fault. All right, this is really critical. We're seeing around the country more hate crimes,
Governor, I think you explained it really quite well. We have community spread in most of the state. I can't give you every county, but I think it's safe to say that we are not seeing initial positives from travel anymore the way we were initially. We are developing a way with the governor to provide better data, more towards cities as opposed to just counties, but I have to make sure that there's no personal health information that is disclosed because some of our communities are very small. So we're working hard to get that up soon. There have been a lot of requests to me to provide that, and we will do that as soon as we can.
And Dr. Grace has more information. Thank you,
Thank you very much, Governor. I was going to say just what Secretary Kunkel said. You know, our goal is to have as much transparency as we possibly can and as much protection of personal privacy as we possibly can. And those it's not always possible to do both of those. And so once you get a certain number of patients in a county or a certain number of people hospitalized, it's easier to drill down. But we respect the privacy of New Mexicans and won't do anything to violate that.
That's exactly right. And just for New Mexicans who when you're in Albuquerque and Las Cruces and Santa Fe and some of the larger cities, being able to remain anonymous when you point out the number of cases. But when you're in a community that has 100 people or less, we have an obligation to protect the identity of individuals. We will do that. We will be fierce about doing that. But we think that we can do more, show patterns and trends, help local leaders like mayors really think about ways to protect their communities without unnecessarily and inappropriately. And we have a legal obligation to protect personal information related to any individual, but particularly individuals who have a healthcare issue or condition. And every New Mexican who tests positive and their families should expect and have a great degree of confidence that this is a state that will not betray that confidence, but will use information in a way that continues to make sure that we protect ourselves to the highest degree.
All right, I'm trying to come back to Morgan. Morgan, I am unmuting you. Do we have you?
Yeah, here, thanks.
Gotcha. Go right ahead.
There was some conversation about that the so-called peak may be hitting in Gallup. How are resources holding up there at Rehoboth and the IHS facility? Are patients being transferred? Are things being sent out there? The other one was on the data that's coming. Is that going to be infections by zip code like some other states are doing?
Go ahead, Morgan.
Sorry, Morgan, what was the...
And you mentioned Sandoval and Santa Fe in terms of retirement facilities. Are there indications of infections there?
I mentioned those because, yes, and I need to be careful. Not that there is indications of, in one community in Sandoval County, we have a positive case. We want to just make ourselves available so that we are testing folks and doing as much as we can to provide valuable information. And if we've got someone who needs to be further isolated, that we can do that. In the Santa Fe facility that we are spending a little more focused time in, is because we know a caregiver has now tested positive for COVID-19, and we want to make sure that we know exactly what contacts and when. Because again, by the time folks have symptoms, we want to know the length of time between the symptoms, the positive test, and last time they were in a particular facility. That's powerful information, and we're providing testing to those facilities so that we know unequivocally. We don't want to guess. We want to make sure that we have accurate information as timely as possible. We think zip codes can be a powerful tool. Again, we want to use whatever information really indicates where we are, where we're headed, and that actual data as compared to our projections is critical. And so you asked specifically about Gallup. So there's no question that with a surge in cases and the number of hospitalizations, that Rehoboth McKinley is in an area where they needed more support. So I'm going to have Dr. Grace talk. I think it was 10 ventilators that we provided. So we do. We have a system where they're clear about reaching out to us. We provide resources that we have. So we operate the way the national stockpile should operate, that working, credible, non-expired, life-saving equipment is made available. That's why we're going to build out with the Army Corps of Engineers immediately. It's where we're going to start the Gallup High School so that more non-ICU, non-critical, right, step-down beds are available. And if we need to, and we might, we are prepared to make sure that patients move to areas where we've got capacity to support them. That's why this relationship between all of our hospitals is critical. I will tell you that that's not happening in every state. If you've got a small regional or rural hospital and it's a private hospital, if they've got a problem or they run out of beds, well, there's really no plan for that. No, we're not going to do that in this state. And I need to thank again the leadership today in front of New Mexicans, and that it's been every hospital and every healthcare provider, public or private, Now, those lines are completely blurred in our state. Frankly, they have been for a long time, but in this emergency response, they're completely removed, eradicated. We work as one unified team, all with the responsibility to serve every single New Mexican. And in some cases, we have folks, frankly, from other states, but they were here when they got sick. We make sure that we treat everyone who is here in the most productive way possible. Dr. Scrace.
Yes, the governor already outlined some of the interventions, but the medical advisory team has a set of principles that we use to make decisions about where care is delivered and when people should be transferred. The first principle, though, is we want people to be cared for in their own communities whenever they possibly can, as long as those resources are adequate. The logistics of transportation and moving people from a border area to Albuquerque and back later are complex. And the second thing is I think we want to expand our ability to provide specialty support to smaller communities. And I mentioned the example earlier about equipment being taken to Farmington, probably as we're having this press conference and getting set up for them today. This story is a good one because it illustrates how the system works. The call came in to the medical advisory team late Tuesday or early Wednesday. We kicked that up to Chris Emery, who's just an outstanding leader at the DOH Department Operations Center. They located the ventilators that they needed, and a very dedicated employee from Taos, who's 72 years old and well wrapped up in protective equipment, took those out yesterday, set them up, gave instructions to the folks in Gallup on how to use them. And so we really are trying to develop a statewide rapid response. And I just want to underscore one more time what the governor said. I've been here for 22 years in healthcare, worked for several of the major healthcare organizations in the state. I have never seen anything like the level of cooperation we have right now, leaders coming together and dropping any sense of competitiveness that they may have had in the past. We really are well on our way to building a single healthcare system in New Mexico for this pandemic.
Thank you. And also we've got the Secretary of Health that wants to add to that. Thank you, Secretary.
Thank you, Governor. And I wanted to add to the to this question that the day that we relaxed the criteria for testing, the Department of Health sent kits to 75 collection kits to 75 nursing homes across the state. And we've assisted 5 of them, not because they had positive cases, but because they wanted our help in doing surveillance. So we're in nursing homes, not necessarily because there are positive cases in the different regions, but because we're doing surveillance, and that's good news. The other thing is San Juan Regional did reach out to the Department of Health and ask for assistance this week. And so the National Guard makes 2 trips to San Juan Regional every day to pick up specimens, both to identify positive cases, but also to help turn around negative cases quickly so we can free up beds. So we are working with them closely, whatever they need.
Thank you, and I really appreciate the clarification. I just want to make clear that if transportation, that has to be part of what we consider, but the focus is to support patients and the communities where they are, which is why, again, this data and social distancing and getting our arms around how that works in some areas better than others. And in fact, for many of our rural, more isolated communities, actually we're utilizing the National Guard to deliver food, supply, and water, because that mitigates their need to travel outside of these remote areas, which also increases risk. So it is a collective strategy that tries to meet the unique needs of every single community, and recognizing that if we don't do that, we increase risk, and also recognizing that every day we learn about something that we could do better and more effectively, and then we deploy it. And we're going to continue to do that all the way through this pandemic. And we're going to bring you that information as quickly as we can in real time so that you can see how we're making those decisions and how they're working.
Thank you, Governor. I have just a couple more. I want to give everyone an opportunity to ask a question. Next, we have Ryan Lowry from the Las Vegas Optic. Ryan, you are unmuted.
All right, thank you. I have a data question as well. Myself and others have been trying to figure out the number of total tests performed in each county, but we've been told the state isn't tracking that information. There shouldn't be any privacy concern there because we're not looking for any personal identifying information, just the raw numbers. So is that being tracked? Why isn't that being tracked? And are there plans to start tracking it?
So Ryan, I'm going to do this in two ways, and I want Secretary Kunkel to talk about that. We could do an entire series on how complicated it is to do testing, and I have become somewhat of a laboratory expert, although by no means am I certified. So there are two issues in particular about testing. One is the one everybody knows that's global, which is the United States is really behind in making available testing kits and doing rapid testing and deploying that effort. They did it in such a poor strategic way. Actually, I would argue that there was no strategy here, that it now makes every state compete for every piece of equipment. And there's three things that you need. One, you need to know what sampling kit you're going to use. A lot of them are universal, so swabs, the medium, the test tube. And you got to be able to have access those, and those are in short supply all around the world. We've done a very good job going after those. We'll continue to do those, which is how we've stood up all of these drive-by sites in many communities, including in San Miguel County. Two, what you use to test it, what reagents, depends upon what laboratory equipment. So that's 2 and 3. So we've taken an inventory of laboratory equipment, things that we call high throughput or high capacity, other pieces of laboratory equipment that can do 1 to 50 samples at a time, but each of them use different reagents, and so you have to negotiate those. All right, so what does that have to do with your question? It's this, that hospitals and healthcare providers before COVID-19, if you went to an urgent care or you went into a hospital and you were being tested for a respiratory illness or for the flu, you know, they do a swab and they can run a sample. And hospitals use a variety of labs. Our bases use labs. Our Sandy and Lanel have their own labs. The University of New Mexico has research labs. The state laboratory has a laboratory. TriCor is an incredible partner and serves any number of hospitals. In the southern part of the state, we use Quest and LabCorp, and the Indian Health Service uses their own lab and testing. So getting your arms around where it goes, who reports it, when it gets reported to us, how timely that is incredibly complicated. I think, frankly, we are in a very good position and have been negotiating with every partner, requiring them two things. If you can't run samples quick, 24 hours or less, we need you to the highest degree possible to stop sending your collection samples out of state. Because when you do that, the Department of Health has no idea who's positive, no idea who's negative, and hospitals don't know, so there's a lag. And secondly, these reporting partnerships have to be done in a way that we get information now into a universal portal. That portal, now I'm going to use the governor's language, which is I want things done immediately. That means that it is immediately done and we're beginning to use it today, but it's not really going to be up so that you can see it until Wednesday. We have to check the data. We have to make sure people are doing that uniformly, and we want to see how many tests are run, where they're run every single day, how many of those were sent to us, and how many were run each day, and where. And the Department of Health is going to have the capacity to do that without chasing that information, hospital to hospital, lab to lab, provider to provider, Indian Health Service, each base. It's not productive to do it in that way. I can tell you that we've run about 14,778 tests, and that we have multiple sites up daily, and that we'd like to expand to make sure that we've got testing capacity. That means a drive-by site in every county, but I'll make sure that I leave the specifics about when you can expect to see that for San Miguel County, so that it's just up. You don't have to ask us for it by the Secretary. And last thing, we can get it for you for San Miguel County so that you can report that in your media market.
Thank you, Governor. I would say that everything that the governor said is correct. It's very difficult to sort through the labs that are not SLD or TriCore. We do have county information. I am getting ready to prepare a report that we can release both for the people who want more than the county and who want to know number by county. We do have that, but the work of ERD, or epidemiology, is really to track contacts and to prevent the spread. So I've had to assign additional people to their database, or to their, I don't know that we can even call it that, but to their data collection to try to sort this out. So what I don't want to do is give you information that is inaccurate, and I need to make sure that the numbers add up. But we are getting closer and closer to giving you county, the number by county, and even a little bit more, maybe by city if it doesn't disclose anyone. And we do have a portal that should be operational by the weekend, and then you can see that. So we will continue to update you as we make those progress.
And I want to hit this hard. It is critical that we know, right, how many tests are we doing and what kind of results are we getting. We can do that in the aggregate, so you get a sense. That's how we use that data to figure out what's going on around the state. But this should be an example of when you have a complex healthcare system with many different private partners who all have different, right, electronic medical record or electronic record systems, all using different labs, and you've got requirements that our information also has to go to the federal government for the Centers for Disease Control. You can see that if there wasn't a national plan, and there wasn't, that this becomes incredibly challenging. And we're clear about that. I want that data too. And so I want to thank, it sounds like we're making people, everyone wants to make this work. So our laboratory partners, folks who are standing up these testing sites locally, are all willing to provide data. We had to create a system that was both safe, secure, meaningful, and productive. And I want you to know that we did that in about a week or less. And now that's going to be available for folks to access reports so that we can get those to you so that you can provide that information locally. And we're grateful for that. And it's a very important and very effective question. Thank you for asking it.
All right, I'm coming back to Michael Gerstein with the Santa Fe New Mexican. You are unmuted. Michael, do we have you?
Can you hear me now? Hello?
Yeah, yep, I can hear you. Go ahead.
Okay, great. On a press call with reporters this week, Senator Martin Heinrich mentioned that New Mexico might not be getting its shipment from the national stockpile of ventilators. I just wondered, Governor, if you agree that that seems unlikely, and where else the state could get more ventilators, if not from the stockpile?
So I agree with Senator Heinrich that that has become an incredibly challenging situation. And the fact is that there are not enough ventilators in the national stockpile for a pandemic of this nature that is a respiratory pandemic that creates the kind of risk for individuals who are infected by COVID-19. In addition, now that we've seen incredible spread, and we've got these epicenters, there aren't enough to go around just in that context. So I think his point is, and it's a good one, that if New Mexico were to rely on whatever our percentage is, whether it gets here or it doesn't, and we're fighting for it, we want it, we're asking FEMA to give us everything we're entitled to based on their population percentage allocations to each state. We're asking for all of it. But that's why the chart that we put out about if we are moderately successful in social distancing, what should we expect, and why I use that number as our benchmark to figure out what we're going to need. And so to that end, right, I'm going to need at least 1,629 ventilators, and we know that that's well more than what we have available. So you probably are wondering, what are we doing about that? We're going to ask for it. We're not going to get that many out of the stockpile. So then we want to look at the FDA approval for how we use our current equipment. We want to make sure that we're purchasing ventilators independent of what's in the stockpile. We are doing that. We want to make sure that the new approvals for using CPAP and BiPAP machines, that we're also purchasing those. Our goal, my goal, is to use this data to have access to all the equipment that we need. Do I have all the equipment that I need today? I don't. Which is why this messaging is so critical. That the fewer people who end up in the hospital, the higher the safeguards are that we have. But I am planning for not the best case scenario, because that's the only way to be prepared and have sufficient equipment. But it is precarious, and I think the point that the senator was potentially making is twofold. Federal government doesn't have what states are going to need, and even where they have access to some of these resources, the way in which they deploy it, I think, is a bit mysterious. Like, I don't know how they decide how states are tiered. They've provided no criteria. It certainly appears that they've given out ventilators without checking them that needed to be repaired, that they've created this incredible purchasing competition that is frankly nefarious. And I'm engaged like every other governor. I am forced to be in that situation. I don't take it lightly, and I fight every day to make sure that we're going to get this equipment. But I think he wanted everyone in New Mexico to be on high alert that this is a very risky set of circumstances that we all find ourselves in, which is why we wanted to show you the data so that you can see what we're up against and hope that you utilize it in two ways. One, you know that we're doing everything in our power to use everything at our disposal to make it right here where we can, to use our labs to do that work, to use local businesses to do that work where it's safe and we can do that. And two, everything we have at our disposal to purchase those anywhere in the world. We're also doing that, but I need everyone's help. And if you don't help mitigate the spread, we will be left like so many other places in the world and in the United States, where Dr. Scrace's team will be left with making very difficult decisions because we don't have sufficient medical equipment to support patients. My goal is to not have that situation ever occur in the state of New Mexico, but it's risky. Dr. Scrace.
Thank you, Governor. Two more things. Number one, just to put a plug in again for the video that will be online. It's short, it's educational, it was put together by our private partners, and it will outline and illustrate for you the different kinds of ventilators. Second thing, a piece of good news, I didn't get into the detail earlier, but when you look at that 1,004 ventilators that we're short right now, that does not include CPAP machines, which the Surgeon General of the United States authorized to use for this. Those are easier to come by. Probably lots of people out there with a CPAP machine in the closet that they're not using anymore. So we think that the number of ventilators is going to be something we can bridge. If you're aware, I get about 20 to 30 emails a day about new ventilator designs and inventions. Number one priority is on those that have been FDA approved. Number two is those that have already applied to the FDA. We have a way of checking on their applications. So just be aware of that as well. We are hearing about private donations of funds and ventilators also, and so it's a great way to help fellow New Mexicans if you're so inclined to do that as well. Thank you.
And I want to give a shout out to your delegation. Your federal delegation has been incredibly aggressive, including Senator Heinrich, to identify ventilators from private sources and donations to make them available to New Mexico. They've been quite aggressive in making sure that we get this information out, that our modeling efforts are important for the federal government because they used only best practice or best intervention models and models that didn't include any of our chronic care or aging data in it. So they skew what it looks like could happen in the state, which means that they may not pay as much attention, make us a high priority state, give us access to as much equipment and support, which is why we had to make such a specific case to get a field hospital, and we're still negotiating the details of that with the federal government. So as I'm engaged as the governor, they're engaged as a federal delegation, and they fight hard to make sure that we get the resources that we need. And he's really clear with the federal government, as is everyone in the delegation, that we need more. But I'm not just, no, you can't put, that's an Easter reference. We are not putting all of our eggs in one basket. We are treating this with a sense that, what do I need to do if I don't get any, if there wasn't a national stockpile? What are we going to do if we don't get any donations? What are we going to do if we don't get to the best social distancing model? How do I support every single New Mexican? So it's an all of the above approach. I think it is bearing real results. The most important is we're not spreading the virus. It's not occurring as dramatically here as it is in other states. We do have some high-risk areas and what we're calling hotspots, and looking at more community containment strategies. And we will continue to find this equipment and use whatever the FDA and the CDC recommends to serve patients and families. But again, what's the best thing you can do? Help us. Help us by not spreading this virus. This virus gets mitigated when it doesn't have any hosts. So don't give it the opportunity to infect a single additional New Mexican. Next question.
This will be our last question for the day, Governor. It is from Hannah Colton with KUNM. Hannah, you are unmuted.
Thank you. Yeah, officials from the Metropolitan Detention Center. Can you hear me?
I can.
Yep, we sure can. Go ahead.
Great. Officials from the MDC said last Friday that social distancing was not possible at that facility. And we learned yesterday that 80 people there were potentially exposed to COVID-19. Department of Corrections and private prison facilities are similarly overcrowded throughout the state. So what is your plan to release more incarcerated people throughout the state? Who will be released, and what's the timeline?
So we are, thank you for that question. It is. Those are areas where we think they're high risk because you've got people in close quarters and you've got folks who have to deliver food and supplies. You've got guards and other personnel that are essential personnel. And that means that they're traveling back and forth. And even though we undertake, strict precautions and no visiting, they're high risk. So you heard the Secretary say that we're actually engaged now with MDC and doing surveillance and doing corrections and are aware of that potential risk, so we're doing more testing. But to your point is, one of the ways that we can address that challenge is by reducing the number of people who are held together without minimizing public safety. So for New Mexicans, there are people who are scheduled to be paroled and released, who meet the criteria, who are not serious high-risk offenders, who have a plan, a parole or probation plan. And so we expect to release, I think, 40 individuals early next week who have a release plan, who will be screened, tested, who will also be required to do that 14-day self-isolation so that they're practicing the most productive, specific efforts. And we do think that mitigates risk, is in line with our community containment efforts, and you should expect us to continue to do that review and that work. And we do think that those are productive policies. So it's about a 30-day early release for the 40 individuals I've mentioned, but we're continuing to expand those policies with our Department of Corrections and our local partners in cities. All right, I think that are all the questions for the day. I know that it's an incredible length of time we ask people to pay attention. I hope it's an indication of how serious we take this effort and how much I appreciate our first responders, our healthcare workers, our child care workers, our grocery store workers, folks who are at convenience stores and fuel stores, everything that's occurring at our bases, our critical mission efforts around the state. All of you have done mitigation efforts, take seriously your role in protecting New Mexicans, but we can do better. So what are the messages? Please don't panic. Please do your own preparation work. Wait for guidance from the Department of Health, but we think it's effective mitigation to wear non-medical masks. We should all promote best practices out of an abundance of caution. We should just treat it like we all have this virus and we have an extra responsibility to prevent the spread. New Mexico overall, we're doing a really incredible job. Again, to the families who have been so dramatically impacted and your loved ones are contained or quarantined in their homes, can't go to work, are in hospitals, are fighting for their lives in critical care, or for the individuals who have lost the battle to COVID-19. Our condolences to those individuals and their families. We know how difficult this time is for you. Your state stands with you, and we're working hard to make sure that we minimize those risks for every single other New Mexican. Thank you for tuning in. Thank you for your help. We can do this together. We are all in it together, New Mexico. Thank you.